Hello everyone, welcome to Sharmit. In this session, we are going to talk about another very important topic related to medical coding anatomy. So we will continue our series, and here we will learn about the anatomical term of direction, that is superior or cranial. So we will discuss what is superior anatomical term of direction, what is cranial, how it is utilized in medical coding terminologies, and all the examples that we should know about superior and cranial. Also, I'll share you some of the important points that will help you to answer the questions in interviews and exam, and also I'll give you some best tricks to remember all these terminology, because in medical coding there are so many things that we need to learn, right? So I'll give you some tricks that will help you to recall the things easily. Okay. But before we proceed further with this session, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic. Because for now we are just talking about the superior and cranial, but prior to that we had talked about anterior, posterior and many other important topics. Okay, so for that what you can do, you can refer the Sharmit digital course book from the description box. There have provided thousands of free resources for all of you, which is available in both Hindi as well as English language. So without any language barrier, you can easily consume the content, and in case you want to ask anything there, you can simply reach out to me through my comment section, where I can personally help you to answer the questions. Okay. Alright, so let's get started. Here you can see I have noted down the definition first, the very simple definition to explain the term superior. So superior means toward the upper part of the body or toward the head. Okay, so whenever you want to denote something at the above or upper part of the body or toward the head of the body, then we will use the terminology that is superior. So in simple words, you can say any structure or a body part that is closer to the top of the body or closer to the head is called superior. Fine. Now let's conclude this. So conclusion is very simple. Superior means above, toward the head or upper part of the body. Now, as we learn about the synonym for anterior, posterior, right? Similarly, we have a synonym for superior also, that is cranial. Okay, so superior is also called as cranial. So both words means exactly the same thing, like toward the head or the upper part. Now some of you might be thinking what is the difference then? If we have same meaning, then why we are using two words? Because it is used in two different contexts. I'll explain you. So superior means toward the upper part, toward the head, and this term is mainly used in human anatomy and medicine. But if we talk about the cranial, it is toward the head or the skull. Embryology, neuroscience and general anatomy. So this term is mainly used for embryology, neuroscience and general anatomy. Clear? So I think now you have idea how it is different, how it is utilized in different context. Now here you can see in human anatomy, the word superior is most commonly used in the general descriptions. But the word cranial, if we talk about the word cranial, it comes from the Latin word that is cranium, which means skull. So cranial is literally means toward the skull or the head. Okay. Now, if we talk about the embryology, cranial is preferred when describing the head end of the developing embryo. Similarly, in neuroscience also, or in brain anatomy also, cranial is frequently used. But on the other hand, if we talk about the human anatomy, both terms are fully accepted and used interchangeably. Okay. As we know, every term has its opposite term also. So if we talk about superior, the opposite term is inferior, which is also known as caudal. Inferior means caudal. Okay. So superior is above or toward the head. Inferior means below or toward the feet. Okay. And these two words always work as a pair. You cannot understand one without knowing the other. These are some basic examples, like the head is superior to the neck, the feet is inferior to the knees. Okay. Now here you can see we have noted down some simple example that will help you to understand like how it is used and what is the meaning that it denotes. The heart is superior to the stomach. Yes, this is true because heart is above to the stomach. The eyes are superior to the nose. The shoulder is superior to the elbow. The brain is superior to the spinal cord. The lungs are superior to the liver, and the kidney is superior to the urinary bladder. Okay. So on both sides, if you look at the common word, here the common word is superior, which means above, right? So everything that denotes above is the superior. Okay. Now, like every term, it is also used in combined directional terms with superior. Like we can create some combined directional terms. Here you can see superolateral. That means toward the upper part and to the side. Superomedial. That means toward the upper part and toward the midline. Superoanterior. That means toward the upper part and toward the front. Superoposterior. That means toward the upper part and toward the back. Now these are some clinical examples. Like a superolateral breast tumor means the tumor is in the upper outer part of the breast. A superomedial orbital fracture means a fracture in the upper inner part of the eye socket. Superoanterior chest wall lesion means a lesion on the upper front of the chest. Clear? So these are the all clinical examples. Now I'll show you some of the most commonly used example in medical coding. So here you can see in medical coding, ICD-10, CM and CPD, the word superior appears frequently. So superior vena cava SVC means the large vein that brings the blood from upper body to the heart. Superior vena cava syndromes mean obstruction of the superior vena cava causing swelling of the face and the neck. Superior mesenteric artery means artery that supplies blood to the most of the small intestine. Superior rectus muscle means one of the eye muscle that moves the eye upward. Okay, and superior labrum tear is slap tear. That means tear of the superior part of the cartilage ring in the shoulder. So this is the common thing that you will notice when you are talking about the superior, that everything is towards up, towards head, toward above. Clear? So now let's conclude this session. So what we learned, let's see the important points. Superior means above, toward the head, upper part of the body. Cranial is the same meaning as superior. The opposite of the superior is inferior, which is also called as caudal. Always been based on the anatomical position. It is a relative term. That means always compare one structure to another. Now we know what is superior, we know what is cranial. Let's try to understand how to remember this for a very long time. So there is a very simple trick. Superior start from S. S relate to sky. So whenever we are talking about superior, S denotes sky. That means towards up or toward the sky. Okay. So whatever is higher up on the body is superior. Your head is the most superior part. Your feet are the most inferior part. Just like floors in the building, the higher floor is superior to the lower floor. Okay. So these notes are very simple. Okay. When you just read it out, it will clear all your doubts. Another very simple way to remember this is superior means the structure you would see first if you started looking at the body from the top to downwards. Okay. So if you are looking at the body from top to downward, whatever comes first is the superior part. That is towards the head. Clear? So yeah, these are the things for today. Now I have one very important question for all of you, and it's very simple. What is dorsal? I'm sure you already know the answer of this question. Please do share your knowledge in the comment section, because once you write the comment, it also indicates me that you want more sessions for this series, and according to the number of comments I will release the sessions. Secondly, it will also help those who don't know the answer, so it will help them to understand the things properly. In case if you also don't know the answer, you can refer the previous session. There I have explained this thing in detail, so from there you can take a reference. But whatever the situation, please do share your answers, because it will help us to reach the wider audience as well. So yeah, that's all for today. See you in the next session with new topics. So thank you for watching Tech Sharmit.